All right. Hello and welcome, everybody. Thank you for joining us for our second in this one-on-one conversation style series where we explore the variety in cardiovascular nursing journeys and kind of just picking through some of the nuances of nursing, but also some of the similarities as we go along. We've been picking people from across Canada. Last month, we did Holly Knight from New Brunswick, and she is currently working at the university, but has dabbled from bedside into the management role and now into the teaching roles. And tonight we get the great honor of Chris Kuttnig, CCCN's very own president, telling us about her journey. But before I give you too many details about Chris, I'm going to hand it over to Ashley Sells, and she's going to tell us a few things that CCCN has in the works right now.
Thank you, Laura. So hello, everybody. My name is Ashley Sells. I'm the Director of Communications and Membership for CCCN National. And I'm just taking a moment to talk to you about a new initiative that we have. Well, it's actually an old initiative, but we're really relaunching it for 6 months. It's our mentorship program called The Courage Within. So The Courage Within is an initiative looking to ignite passion and support you throughout your cardiovascular nursing journey. So whether you're looking to be mentored or be a mentor, this is your chance to grow. So for example, do you have a passion and expertise in cardiovascular nursing and want to share that knowledge with others? Or maybe you're new to the field of cardiovascular nursing, or simply looking for some peer-to-peer mentoring as you transition into a new role. So not just for new nurses, but you might want mentoring in all kinds of different areas. This mentorship program is set to run from October 20th to April 20th and will include 3-month and 6-month check-ins from us nationally. So the intake is happening right now. And you must be a member to join. So if you're not currently a member, we'd love to have you. And thank you. So that's just my short little spiel about that. For those interested, I'm going to post in the chat a link to the mentorship program page on our website, which will provide details on how you can register, and then also a link on how to join as a member if you're not currently a member. Thank you, Laura.
Thanks, Ashley. One of the things that's come up in both last month's conversation and then the one we did a year ago with the 3 people in a panel was the amount of opportunities and where it will take you when you just say yes and you make yourself open to opportunities. So it's an excellent segue into that mentorship program. Maybe you're on the fence on it, but like what is the worst that could happen if you said yes to this scenario? And who knows where it will go or what you will learn. And so yeah, it's a trend that the people that I would consider leaders and exemplary nurses got to where they are by saying yes and exploring things and just being open to those opportunities. And also, while you're on the website, maybe take a peek over on the events page. Rumor has it there's the webinar coming up. It's in French, and yeah. So anyway, there's lots going on the website. The directors have been really working hard on updating some of the programs we offer and making sure that there's lots of fresh content out there as we go. Today, as we're going along, if you have any questions, comments, concerns, feel free to throw them in the chat or raise the hand and we'll weave it in as we go. A little extra engagement is always more interesting for webinar chats, as we know. But I think Chris will also hold our interest as we go along. Chris has been a registered nurse since 1997. She dabbled a little bit in some med-surg ICU before finding her calling in the land of cardiology. And I don't want to steal too much of that journey. I'm sure she will describe it beautifully in her own words, the goods, the bads, and then we'll go from there. So I'll hand it over to Chris so she can give us the high level rundown, and then I will start with my 20 questions.
Fair enough. First, thanks for having me, and thanks to those who are joining us today and taking out time out of your busy schedule to, I don't know, hear about some of the amazing nurses that we have. I guess I'll call myself one of those. I think I'll start by saying I never had an interest, desire, or knowledge to be a nurse. If I look back on my career, I am the first in my family to go to university. I'm an immigrant child of immigrant parents who came to Canada for sort of a better living and a better quality, and grew up on a farm, but always loved school. You know, I want to say I was that nerd, but I was kind of like not the one with the, pencil in the pocket, even though that's what my husband calls me. But I always just loved school, loved learning. And, as a I won't date myself, but when I was going to school, really, I loved math. I loved science, and thought I would be a chartered accountant. That was my goal. I remember getting to high school and getting my one of my high school teachers, they had to sign off when you were gonna, from grade 10 to take your next course. And I wasn't gonna take physics and I wasn't gonna take chemistry. And I remember my grade 10 science teacher saying, "You're gonna regret this someday, Chris." I said, "I am not gonna need that because I'm gonna be a chartered accountant." Anyways, went off to university and to the Faculty of Business Administration here in Manitoba at U of M, and absolutely hated it. Survived a year and a half, I will say, what was probably fairly tough, competitive. It wasn't sort of my type of environment. Probably suffered from some anxiety at some point before I withdrew because it just wasn't a really good fit for me. And I left university after, being a child who always said from the time I was really young, I'm going to go to university. I'm going to do something different and move away and go to school. And then after a year and a half to find that that dream wasn't really what I wanted and didn't know where I was kind of landing. And really struggled at that point, left university and, was walking in a mall past and looked around, what am I going to do with my life now after this? And spied a travel agency there. I thought, well, I really, I'd like to travel and what the heck. And so I went to travel agency school and became a travel agent and did that for 7 years until I met my now husband and his family. His mom and all of her friends were nurses. And I was working in the field, travel agency, maybe it's changed. It was very poorly paid, lots of long hours, good customer service experience. Rob's mom said to me, you have to go back to school, Chris. Like, you need to go back to school. And I said, I do need to go back to school, but I don't know what I want to do. I said, maybe education, maybe law. And like I said, Rob's mom was a nurse and all of her friends were nurses. And they said, you should become a nurse. You would be a fantastic nurse. And I thought, I didn't know nurses. I didn't know anyone in healthcare. I certainly didn't know anything about nursing. But the rest is probably history because I did apply to nursing. I initially applied to St. Boniface to the School of Nursing, the RN program. That would have been many years, somewhere in the 90s. And they still had diploma programs at that point. And, you applied, you interviewed, and I got in. I was super excited, going to start in September. And then the government of Manitoba said, yeah, we're going to get rid of diploma programs. And they decided somewhere in that summer to, get rid of the RN program out of St. Boniface. And again, I was like, oh my goodness, now what am I going to do? I guess I'll just go back to my stay in my travel agency job. And it was, the government at that time said, you can either wait a year and apply to a different hospital, or you can, we'll waive the entrance deadlines and you can go into university because I had already been, a year and a half under my belt, I got into the faculty and started partway through, I guess, my second year. My now husband, he was sort of going through in the 90s. Jobs were not plentiful. There was he was often laid off in the winter months. He was a truck driver at the time. And so he decided he'd apply to a job in Calgary, and it's like, oh, great. We got engaged at the same time. So it was like, well, I guess we're off to Calgary. And as I tried to transfer to the University of Calgary, I did not have high school chemistry. There was my grade 10 science teacher's words in my head saying, you're going to regret this someday. And I thought, yeah, you're right. So I took a year when I moved to Calgary. I actually worked I guess I kind of worked as a healthcare aide, health assistant for an agency. So I was an agency worker at one point, and while I was doing that, I was doing distance grade 12 chemistry from Manitoba, because in Alberta, you couldn't take grade 12 chemistry unless you did grade 11 chemistry. So tried to take chemistry via correspondence, not exciting. anyhow, so after a year and I got back into the faculty and finished, and I started off, my career in nursing really was, I did a practicum in cardiac surgery, was almost like a step down-ish unit. And then my last practicum, because we did two, was vascular surgery and general surgery. I was already a mature student when I finished, and within probably not long, I knew that ward nursing was probably not where I wanted to be. There was just something, I think I worked with a lot of nurses, and this is where, the influence of many that you surround yourself with. I remember a nurse who, I remember working with her, and she worked the ICU at a different hospital. I thought, oh, that's pretty cool. But you know what? I don't know. Maybe I don't want to do that. So did a little home care, dabbled in home care. Beautiful area, beautiful clients. Not my thing. Went back and I thought about that ICU nurse, and I started my career in a trauma ICU at the Foothills Hospital, big ICU. I think it was 30 beds. If it wasn't 30 beds, it was almost 30 beds. It was big and crazy. You did a week in the classroom and a week of buddy shifts, and you were a trauma ICU nurse. I think that formed me into later what I became when I was an educator, always remembering those first days in the ICUs and how scared I was. And then we moved, I moved to a different hospital, which had a CCU as part of it, which I kind of liked. I was like, oh, this is med surg CCU. I kind of like these patients. They talk, they walk, they come in, they go out. Beautiful. And was kind of a nice mix. And then we moved back to Manitoba, and then I started in a medical ICU and CCU here. And most nurses that worked in that medical ICU, CCU never liked CCU. I actually liked CCU. Still no inkling I was going to be a cardiovascular nurse at this point. I had the opportunity, somebody asked, I was kind of interested in teaching, and would I do some teaching? Sure, at Red River, I did a little teaching I actually taught a health assessment course in a lab. I taught medical terminology anatomy to unit clerks. At the college, I did that. And then I wanted to do something else. I really actually wanted to be the educator of that it eventually became a med surg ICU. And that was my end game. I'm like, I want to be the educator of this unit. And I interviewed and I lost out every single time. I think I applied twice when it was open and lost out each time. And eventually landed a term on in cardiology. And I fell in love. I kind of came to a place that just fit. I don't know what it was about it. It was addictive, exciting. Loved the people, loved the kind of education and research that was happening, and ended up staying as an educator in cardiology in some form, different areas of cardiac program for 15 years before we opened the current, what I am in the CCU now. And I probably would have retired as an educator if the manager of CCU probably didn't move on to a different career. And I have and those that are on the line that know me, I am impassioned about CCU. I love CCU nursing. I love the patient population. There's so much about it. And though I never really wanted to be a manager, I knew that you had to work tightly with a manager as an educator. And I thought, what if they don't love CC like I love CCU? What if they're terrible? I don't like them. And so it was a put up or shut up, and I made the leap, and that's where I am now as a manager of what's called manager of health services for the acute cardiac care unit. And I have the critical care resource team under me as well. And it's so much better than I ever thought it was. I didn't think I would ever like being a manager, but there's a lot of really good things about it. There's some tough parts. So that's kind of where I am career-wise now. And I know you're going to have lots of questions, so I'll leave it there. Some people have heard this story and go, what? Anyways, but
I mean, the whole travel agent part was definitely a surprise on my end. You mentioned something in that you didn't know where you wanted to land. You didn't know what you wanted to do. My own nursing career, I had no idea what I wanted to be. Actually, I wanted to be a stay-at-home mom, but I needed to do something in that time frame because not a lot of good stay-at-home mom gigs for 18-year-olds. Uh, so, so I was going to go be a drug rep. But my mom and my husband's best friend kind of bullied me into nursing, and they were like, "No, you should apply for this. You could do this," and I absolutely love it, and I am so I now pretend I'm a stay-at-home mom with a hobby job of nursing, but it took some time to get there. And then also another thing you said during that really reminded me a lot of something Sheila O'Keefe McCarthy said. She started her nursing career with no interest in doing research whatsoever, which now if you know Sheila is a researcher, and she's a beautiful researcher who tells the most magnificent stories out of her research. She can give a voice to things that otherwise are missed entirely in the world of healthcare and cardiac disease. But she had said that she liked nursing. She was going to be a nurse, and it wasn't until somebody came alongside her and said, "No, you should come and try this. You should do this." And it's remarkable that if you have a good supportive group of people around you, the things that they will see in you that you won't see in yourself, but they'll say, "Oh, this would be an excellent fit for you." Or I'm sure when you started floating around the idea of becoming a manager, people were like, "Yeah, 100% you should do that." Or did you float it around before you did it?
No, not really.
You
Not,
kept that
I
one
mean,
close,
I
right?
have been asked by previous program directors. I
Mhm.
think this is the usual, where do you want to go? And once you're an educator, what are the next steps? So I think it's always a natural. Have you ever thought about management? I was like, no, thank you.
No, thank you. Yeah, I hear it. But it's interesting how that goes along the journey. And if you're open to it, if you're open to saying like, "Well, I think I could do this, and I certainly don't want somebody who would do a worse job than me doing this." So here we are. And it ties in a lot of the advertising. I defined you as a reluctant though natural leader. And your story exactly says that. You weren't seeking leadership positions, doesn't sound. You just naturally have fallen into them. And having sat alongside you in the board of CCCN, I would say that you are a natural good leader. I have what did you want? You didn't know what you wanted to be when you grew up.
Like I said, when I was young, I wanted to be a chartered accountant. And that
Right.
was only because really, if you look back, and I'll date myself by saying, high school in the 80s, the breadth of career options. And I also grew up, on, like I say, I'm the first to go to university. My parents were immigrants. They were hardworking farm folks. And all of their colleagues would have been farm folks, etc. So I was naturally good at or loved math and science. And so it was like, oh, I'll be a chartered accountant because what else would I have? There was nobody I knew that was in healthcare until I met, like I say, I met Rob's mom, who was a nurse, who she also went later in life. But she also, one, it was that interest to go into back to school, do something that was more than order, which
Mhm.
travel agents have become more order takers. But again, it is something where you say someone sees something in you, and Rob's mom
Mhm.
and a lot of her friends were very pivotal in my career choice. To then they said, you would make a good nurse. It's a fascinating career. My mother-in-law was an NICU nurse, tried to get me to go down that path, and I was like, yeah, no. But even along my career, if I think about it, I had fantastic um, role models,
Mhm.
mentors. I think that probably led me down some paths. Even I look back now and I see that because I can remember my preceptors, Trish and Sandra, if you can remember, like this is the 90s. I remember their names. And they were just fantastic nurses. And they were fantastic nurses because they had heart and empathy and compassion, but they were intelligent. They had great communication skills. They were great team players. Um, and so I think, working with them, you want to model yourself after that. And then even when I entered the ICUs, I had, particularly not the trauma ICU as much, but the second ICU, I had two educators there that I put on a pedestal. They were fantastic. I think that's what led me down to think about education, because they were fantastic educators. And why they were fantastic was they were very current. They were on the floor. They were there when you wanted a question and you said, hey, they just walk by you and how are you doing? Okay. Or I have a question. And, those days we put pulmonary artery catheters in everyone. And so they were always available in the unit, and they really modeled who I later became. And that's what I saw. And that's how I modeled my educator style, I would say afterwards, is that, you surround yourself with people that you gravitate to, you look at, you aspire to be. And they probably too were reluctant. They were very humble pie people. Even today, I work with a fantastic group of my team of managers, my program director, same thing. Fantastic, strong leaders, nurses, current. And again, I'm just modeling the same way, really, that they have taught me. And I'm just doing the same thing. And again, I know I'm humble pie. Sorry, that is my way.
No, can you speak at all to that transition from being the nurse who's surrounded by the people on your pedestal, and you're looking at them and you're like, I want to be a piece of you, and I want to be a piece, because this is how I view my nursing heroes, I'll call them, of like, oh, this part of you I would like to emulate, and this part of you I'd like, and hopefully I can build this really fantastic Frankenstein nurse that is like the best nurse ever, because I've borrowed from all of the characteristics I like of other people. But when the transition between sitting and looking and being like, I like this and this and this, and just soaking it all in, to then being that leader where other people are looking to you, being like, oh, well, I like this part of Chris, and Chris is that leader. Can you speak to that transition period at all?
I guess I can look back at, if you ask me, but I would say I don't even think about that piece of it. I think they created a curiosity in me to try different things. So I was at the bedside, I was working in a med-surg ICU, and I was like, you know what? Somebody said, I heard you want to teach. There's a chance at Red River. And then it was like, then I applied for a job as an educator, and I just hunkered down and did the work. And I spent the time on the unit. I don't know that I probably just subconsciously work towards what I saw that I loved about those educators, that they were current, they were available. I love informal teaching.
Yeah.
That is my favorite type of teaching. So that's why I never stayed at an academic or desired to go to an academic center, because I did teach at Red River College, but that wasn't really and I have done lots of formal education stuff. But what I love the best is the stuff. And I think that's what I kind of saw in those leaders. Those were the things that I really valued, and that helped me, because I felt like that's where I was needed. It was at the bedside to help people just give better care. And so I don't know that I consciously, like you say, like, that you're picking those pieces. I don't know. I think looking back now, I would say, yes, I have picked those pieces out from others around. And that naturally fit my own style as well, right? I mean, hard to believe that people often ask me, I'm actually an introvert. I have, I like my quiet time at home. I was a shy kid. People are always like, yeah, sure you are, Chris, but I was, right? And I don't know. I love that informal piece of it. And I guess I never really consciously, you asking me about it, I don't know that I made those conscious decisions. I just kind of gravitated.
You
I
didn't,
stand. Oh
you
no,
didn't
it's
find yourself in the room and say like, oh wait, I'm the grown up here. Like, wait, who's the
right.
grown up here? It's
Yeah,
me.
right. It's like me. I'm the leader. Uh-oh.
Yeah, here, Sarah has her hand raised here. Let's
Oh.
bring Sarah into this.
Well, I'm lucky because I get to work with Chris every day. But I was going to wait till the end, but I think you said something that just made me really curious. So, when you're thinking about your career path and maybe asking for a friend, because I haven't figured it out yet, but nurses often really love that clinical, going in, hands on. You see the reward of your work, whether it's like supporting a family or actually seeing an improvement in a patient. But when you think about going from that and talking about your love of education and thinking about succession planning, in my mind is after, like, what would you say to somebody that you recognize in a clinical setting, but they love bedside nursing? And is it the impact of what administration role does, manager, director, even educator, and then that fear of, but I love nursing, but you can maybe see that they have something. I hope you know what I'm trying to get at, because as you know, I like to try to go in and help, but I'm so rusty I can barely get like ice chips and a warm blanket anymore, which very much affects my soul. But anyway, so what would you say to somebody who is at that kind of turning point of, I need a little something? How would you articulate, I guess, how you can still bridge that love of clinical, but be a leader?
That's a really good question, Sarah. And I remember even going into this role, because the one thing I loved about being a clinical educator is I could still be on the floor, and I felt like I had a connection to patients, and that my work with the nurses improved their care. And I was really worried about that going into management, that I was going to be in this office and just doing pencil paper stuff. But I remember Rhonda, at the time, right? We worked with Rhonda, who eventually was our CNO, our chief nursing officer, said, when I went to her and I asked her for tidbits ready for my interview. And then one of the biggest things she said to me is that don't discount the impact you make for patient care just because you're removed from patient. Like, you don't have to be at the patient's bedside to impact care. And it was like, what kind of thing? And it's so true. And as I now think about even the role of CCCN and where you have opportunities, is that you can still get that sort of feeling of like fulfilling that patient care piece, but it doesn't have to be by touching patients anymore. You can set the tone for an environment that makes for good care. So as a manager, I always say when I talk to nurses, what can I do, or et cetera, my job now is to make sure that you have the tools, the resources, and the support to give the best care so that our patients get good care. And so I think sometimes, right, when people are like, well, I love patient care, well, you can still you can impact care through policy development, through working on, things like procedures, by managing a unit, by moving up in different kinds of roles that might not necessarily be at the bedside. And sometimes I think we have to be reminded of that, because I think when we first start, I think the bedside is everything for many of us, right? It's hard sometimes to pull yourself back. But I think there's so much impact. Like I think of like Sheila, like you talk about as a researcher. Wow, talk about impact, right? Sarah, who's on as a program director, who's, dealing with things at a regional level to make sure that our patients get the best care, right? And so I think, and sometimes I've just had a couple of performance conversations with nurses this week to prompt them to say, they're like, well, I love care. And I said, well, do you want to do this for the next 5, 10, 15 years? I don't know. I can't think of anything else. So do you want to teach? Do you want to do research? Do you want to do something? Because it all ties back ultimately to good patient care. I don't know if that answers that question, Sarah.
It sure does. Thank you.
Chris, that was, I I love that question too. That was a good question. That transition from that physical, tangible bedside where in your 12-hour shift, you might have a patient who you didn't think was going to make it to the end of the 12-hour shift, and then they did, or maybe they didn't, but you still carried through that care continuum. To take your point, Chris, maybe you're physically a little further away from the bedside, but you're still empowering those nurses to deliver that excellent care. And I think we probably all think of units within our facilities that we work at that the managers are not empowering nurses to provide or encouraging them to provide that excellent care and that necessity for that passion of nursing to still trickle through and encourage that way. I really liked that question. That's a good question. And I think a lot of nurses are terrified of that step to be at bedside, which is why when we talk about these career journeys, it's not just like, oh, if you're a new nurse and you want to come, like, no, if you're an experienced nurse and you just don't know what the next step is, or maybe you're kind of curious about the next step, like, let's talk about it. Because you might spend 20 years at the bedside and then be like, I love this, but maybe my back can't hold up to it anymore. But I'm not ready to give up nursing, or like maybe my family needs are different now and shift work isn't the best answer for us now. And Monday to Friday is, or something. I always told like the amazing flexibility that is available in nursing for like the stages of life and family and moving around, following your boy or whatever, or your significant other, whatever. I don't normally tote that as like part of the education phase, Chris. That's kind of a thinking outside the box scenario. Usually it's once you're licensed, you can do anything and go anywhere. But
It's funny. So, as a mom of a couple girls and now mom of one nurse and one trying to get into nursing, but we always have in grade 9, you bring your kids to work. And one of the things, that I always touted, because each one of my kids always brought a friend, I always said the beauty about nursing is there's no cap on what you could do as a nurse. You can go to take that nursing and then take a law degree, and imagine that, and go work off in the protective society. You could go work on a cruise ship. You could open your own shingle, and do BLS and ACLS out of your house. You can be an administrator. You can be whatever your imagination allows you to think of. I think nursing has that. So we're very lucky in our profession. I remember speaking to one of my cath lab docs, and he said, you guys don't know as nurses how lucky you are. If tomorrow, Chris, you wanted to be an NICU nurse, you would just apply and change your career. And I went, yes, I could. He says, I took 15 years of school. I can't just become a pediatrician now. I'm kind of stuck where I am. And so I think for nursing, we're really fortunate in the kind of careers that we can, take ourselves, whatever path, whatever journey like this is all about. I think it's your imagination is all that's limiting you.
I totally agree. My husband and I have this conversation often about, especially now, where you to be a nurse, to be a registered nurse, it's a university degree. Even at the end of the day, like, you have a university degree. If there is zero interest in traditional nursing, we'll call it, like, you can go do anything else, basically, right? Like, there's so much flexibility there as long as you can pitch the skills that you have and the ability that you have to learn, and that you can write and you can communicate. I mean, obviously, I would encourage everybody to stay within the field of nursing, and specifically cardiovascular nursing, because that's my personal passion as well. But there's so much flexibility in it. And even within cardiovascular nursing, there's like EP, there's cath lab, there's surgery, there's floor nursing, there's cardiology, there's specifically just heart failure. There's community nursing and NPs, and then the roles amongst those. Even just in today, we've talked about bedside and educator and manager within your career path. And then you said we have somebody who's like a director of a program on here tonight too. So like, there's so much option. It is crazy, and just learning how you can make one step to the next step, or even what those options are. So many people are like, yeah, but what do you do? How do you get those jobs? What's out there is a good big conversation. I'd like to do something a little different, Chris. Are you familiar with the game Cheese or Chocolate, or Would You Rather? It's a rapid fire question. I'm going to give you two options and you tell me which one you want, but you can't think too much about them. You just got to give me the answer, and you don't need to justify it either. We can unpack some of them a little bit after we've done this. I didn't make Holly play this game. I'm trying something new. All right, we'll start with a couple of easy ones, and then maybe they'll get harder. And some of them, I think you've kind of already hinted towards what your answers will be. You ready?
Okay.
All right. Coffee or tea?
Coffee.
Regular or carbonated water?
Regular.
A prairie field or a coastal bay?
Coastal bay.
Intubated or alert and oriented patients?
Ooh. Ooh, that's a really hard one.
Yeah, you're thinking too long.
I am thinking too long. Okay, I will take the intubated.
Okay. Day shift or night shift?
Day.
Intensive care or a ward?
Intensive care.
Hiring new grads or non-cardiac experienced nurses?
Ooh, I guess in my own role, I guess this role I can't hire new grads, so I'll take non-experienced cardiac nurses.
Take anybody. A mini education session like a lunch and learn or a journal club?
Journal club.
Perfect. Giving an oral presentation or a poster presentation at conference?
Ooh, poster.
Okay. Listening to an oral presentation or a poster presentation at a conference?
Listening to the oral.
Okay. The educator role or the manager role?
It's unfair.
It is unfair.
Oh my God. Educator.
Okay. Or I already asked one. Which is more labor intensive, being on the provincial executive for CCCN or being on the national board for CCCN?
The national board of presidents.
Okay. Well, what about as president or the director of provincial directors?
Oh, yeah, president, much more labor intensive. Yeah.
Do you prefer a work call or a work email?
Call.
All right. And a potluck or ordering in to work?
Potluck.
Potluck day in, day out. Some of those surprised me because you talked about in the ICU how like you started to see some of those CCU patients and how they were awake and they were doing they were engageable in that capacity, and that helped to draw you into the world of cardiology.
I know, and then I said the intubated patient because the acuity sometimes. It wasn't so much about, I know, you become the jaded ICU nurse when your favorite patient is intubated, sedated, paralyzed, and an orphan.
It sounds awful, but it's the same sense of humor in that a good nurse likes a sick patient.
Yeah, I think I like the sick patient for some of the learning and the teamwork that goes with it. But then there's something so satisfying about an alert orientated patient that you can have interaction with.
Yeah.
That's why I love CCU, because you get both.
Yes. Yeah. I like that diversity in CCU too. You might some days you go into work and you really just hope you have a vent in the corner and no one's going to talk to you, and it's going to be a night shift for me, and I'm just going to sit there with my vent. Maybe they got a balloon pump and it's going to lull us both to sleep. I don't know. But then other days you go in and you thrive off that engagement with your peers and with your patient, and that sometimes solidifies this is exactly why we're doing this. This is mixed there. I get personally very excited about a lightly sedated, well intubated patient who I've had a couple that are like able to no answer some questions while they're lightly sedated, and they may or may not
still interact and can write
and I mean, if they're uncomfortable, like obviously we need to sedate them more, but like if they're saying they're not uncomfortable and they often want to try to communicate, I find that a really interesting scenario that I really like now. 5 or 10 years ago, I would not have been okay with that, and we would have been jacking up the propofol.
Yes.
Yeah, just that's what you enjoy along the journey there. Can you gave us your overall career path. Now, can you explain to us how CCCN has weaved its threads or tentacles, its grasp along your journey, your career journey?
I think I was naive bystander. So Esther Lita was at some point the provincial director in Manitoba. And Esther Lita was a CNS on the cardiology ward where I became a educator and, you know, very novice cardiovascular nurse. And I remember her saying to me, you know, we're going to plan every year, we plan this, you know, keeping current. It's a full day conference. And, you know, do you mind helping? And I naively said, oh, okay, not realizing that she had thrown her web. And there I was. I think I learned many of her tricks that way. And so then I got involved in helping to create this full day conference. But at the same time, it wasn't what it was. I think for me that hooked me right away was I'm a very relational person and connections. And right away, you know, Estrelita was part of it. There was 2 educators over at Health Sciences Center. One was in vascular, one did something else. There was someone else, and I was hooked. And so that's why I think, you know, that when we talk about CCCN and the ability to network and to make relationships and connections and contacts and learn from each other, that I think that sucked me in right away. And next thing you know, Estrelita's like, oh, you know, you want to come on to the provincial chapter? I'm like, sure, I guess so. And they, you know, the rest I almost feel is history, because then, you know, I think I am innately I think many nurses are a people pleaser, like to help. You know, I kind of, that feeds into that part of me that, you know, wants to be helpful and useful. And so coming on in that capacity and learning from those people, and it's like, well, I don't, as my husband always says, the only place I say no is at home. But he's always, you know, sometimes you could put your hand down, Cress, or I could tape it down. And, you know, my natural tendency, and you said so many times when you say yes, it takes you down opportunities that I probably wouldn't have done. And so when Esther Lita asked, I said, sure. And I first came on as secretary treasurer. I was a terrible treasurer, I'll tell you. I mean, I went to our first, you know, AGM with like the finances on a paper towel, because I kind of last minute said, oh, we have so much money in the bank and this is what we spent. And, you know, next thing you know, it's, I think you should be the provincial director. Yeah, I think so. I do better. I'm a better orchestrator, I guess, than I am, you know, in terms of that. And then I think I kind of got hooked into CCCN then, right? Because I was also at similar time, I was actually on the Manitoba chapter of CACCN for a while as professional education chair there. And the same thing, someone said, you know, we're looking for someone. Do you mind helping, Chris? Okay, sure, I will. And but CCCN, I think what I really always loved, it's given me a lot of opportunity to meet some fascinating people. And again, you know, I look even over who's on the group here. I look at like Lorraine, thank you for joining today. I mean, Lorraine was a CNS, and again, I worked a lot with Lorraine, who I think gave me opportunities to work on projects that were, you know, we did an out of province transport, Lorraine, and I got opportunities to work on stuff and meet people, and just make a difference to patient care through some of the work that we did. And even in the CCCN work, you know, seeing a room full of people at a conference that you helped plan, and seeing people go like, how was your day? That was great. I learned some really great things. There's something so fulfilling for me in that. And CCCN fits that for me, and that ability to network, to say that, you know, when Holly did hers last week, I'm like, oh, finally I get to see Holly's face. Because over the years, Holly and I have connected through different things, or through educator emails, or networking across the country. And so that's kind of how I, you know, fell into CCCN. But it has also afforded me a great network, especially as an educator. I reached out lots. And as a manager too, I've gotten references from some folks, or I've had somebody reach across the country to me, and we've connected about what's your practice there? What are you doing over there? How are you managing this? And I don't know, if I wasn't part of CCCN, I would not have that national network to draw on.
Holly is the reason I also am a CCCN member. She coaxed me into my first meeting. Why don't you come? Like, just, you don't even have to be a member. Just come to that meeting. And then suckered me also into being the treasurer and secretary for for a bunch of time.
Yeah.
And then we went. But it is that saying yes a lot of the time, and that being open. And then again, we've talked about it, that surrounding yourself with these people who we emulate, who are already engaged in these organizations. And I'm going to throw the same question you threw at Holly at you. So you say yes to a lot of things. Is there anything that in hindsight, perhaps you should have said no to?
I've thought about this question ever since I asked the question.
I tried to warn you, it'd be coming.
I know. And I thought about it I've actually thought about this for the last couple of weeks. And I think there were many things I think, should I have said no to? Should I have said no to the opportunity to become the president of CCCN? I think, oh my God. Or should I have said no to even stepping onto the board? Should I have said no when someone said apply to the manager? And now when I look back, I think, no, there is nothing I would now say no to, because it all built where I am today. Even even going to university and failing at things. I fail, like, and my girls laugh because, my girls, you're as your children get older, they probably do think, they just see I have a good career. I'm the president of the association. And I think they don't realize the steps that came to get here. And my own children who struggled with different courses, I said, did you know that I dropped out of university when I was like 18 years old? And they're like, what? And did you know I failed my first ACLS? I used to tell this to people because I was a baby ward nurse that didn't work on a telemetry unit, but just thought, oh, I'm so smart, I should take ACLS. Couldn't read a rhythm. And in those days, they didn't teach you rhythms. They didn't teach you anything. And ACLS was hard and I failed. And I think, but I learned a lot and I used those things. And so now I look back and I think, I don't think I would change a thing. I wouldn't change a thing about leaving university. I wouldn't change a thing about being a travel agent, because I think maybe I should, I've thought about it lately. I think I should have gone into nursing earlier. But then if I went into nursing earlier, I wouldn't have failed at university and knew I could pick myself up and do something else. I wouldn't have been a travel agent, which in and of itself, I saw parts of the world. I learned customer service, which healthcare is about customer service. At the end of the day, we have a clientele. And I learned a lot of really, really good customer service. I learned time management. I learned how to organize myself. I learned how to work under deadlines, and those things I would never have learned, because when I came to nursing, all those things helped me in my patient care. I remember an instructor said, I know you're a mature student, Chris, but she said, what did you do before you came into nursing? And I said to her, well, I had been a tour guide for most of my summer jobs, and I was a travel agent. She goes, I could tell. She says, because you have customer service, time management, like all those skills I learned along the way. And if I had said no to some things or never done something, I wouldn't be where I am today. So no, I wouldn't change a thing now.
Is there a piece of advice or encouragement, or maybe a warning, that you would give past Chris at any stage, either 18-year-old Chris or 2007 Chris, or whichever stage of Chris?
I think it would be to say, don't get comfortable, right? Don't just be, I think always, like, don't be sort of unhappy in your job and get comfortable, because, as you get older, and now if you look at our patient population, they're getting younger. And I don't mean because I'm getting older, they just are getting younger. But life is really, really short, and your career, in the blink of an eye, you're going to be 20 years down the road. And you should do what makes you happy. So if where you are right now isn't filling you for whatever reason, it's not the kind of nursing, it's not the team, you're not getting out of the team what you need, which is support, encouragement, that mentorship, then don't just sit back, then move along. And that's the beauty about nursing, is there's no excuse. There's absolutely no excuse to say, I don't like my job, I'm happy, I'm miserable, this place sucks. There's lots of places out there. And so don't limit yourself, right? You know, but also give yourself some grace. You don't have to do it all at once. I think we're very hard on ourselves as nurses, right? You know, surround yourself with good supports. Even this job as a manager, it would be a really, really hard job if I did not have the incredible team I work with every day. Because there's some days there's some tough parts to it, but I love my team. And when I'm down, you know, somebody picks up the phone and goes, everything okay today, Chris? No, not today. It's not. Right. But you got to surround yourself with those people. And if that means moving to a different unit, to a different hospital, a change, go out into there's no excuse.
Mm-hmm. I love chatting with you because a lot of the things you say resonate with core values that myself and my household have as well. We often say to each other that comfort breeds complacency. And if you get to comfort, even comfort in a good, like comfort in a good way for stages is a good thing. You need a period
Yes.
of rest. You
Yep.
need, if you are happily comfortable, not unhappy and unfulfilled in your employment, but like sometimes you do need that period of rest. It enables you to restore, build up, maybe invest in some others around you, focus on some other
Yep.
things. But if you get too comfortable in that stage for too long, it makes saying yes to the next opportunity scarier. It makes it feel bigger. You have more to lose or something like that. But then
Yeah.
on the flip side, like, what are you sacrificing as far as like what you could learn? What other opportunities are out there that you're saying no to by sitting in comfort for too long? And then our household also says, Runcies start with yes, and there's the and that has to come after the yes every time. And it might be something like, yes, and will you be able to support me to do this? Or like, yes, and it needs to fit within these constraints. Like we start with yes, and then we define it from there. Sometimes at the end of the conversation, it doesn't end in yes, but it starts with yes.
And even comfort, Laura, like, you know, I was an educator for 15 years, and you think that's a long time as an educator. But if I look at that 15 years, it was a lot of change in
Mhm.
the organization, in the units that I did, in the building that we did. So I think you can be comfortable in a place as long as you're getting the challenges that you need. So you're either learning new skills, you're maybe, you know, you're still in the same unit, but you've decided, you know what, it's time for me to take charge or be a
Mhm.
resource nurse, or I'm going to go off on a conference and just stretch myself a little bit because I'm
Yeah.
not very knowledgeable about this, but I could do that. So I think you can push yourself, whether that's
Mhm.
moving around or even where you are in that one place, but you still got to stretch because you can't, you're right.
Can't
You
be
want to come to
complacent.
work and just be like dialing it in. It's a
When we
long career.
It is, yeah. When we moved from New Brunswick to BC, there was a lot of unknown, a lot of change, a lot of things we didn't know. And I was like, well, if I could just get a job in a cardiac unit, I don't care what kind of cardiac unit. Is it a ward? Is it a CCU? I ended up in a cath lab, which was new to me, but I was like, at least I know cardiac anatomy, right? Like there's this one little piece of comfort I have in all of these new things. And at that time, it was wonderful to be able to lean into something comfortable while everything else was new. And so like still learning and growing with a comfort zone. Um, yeah, I'm wondering if anybody else has any comments or questions. I see we're coming up on that hour mark. It kind of
Oh
flies
my
by,
God.
I find. Does anybody have any thoughts or questions, comments, concerns they'd like to throw in? Maybe while you're finding the hand raising button or typing them in, I'm going to put a plug in for next month. I'm doing another chat with Kate Dagg. She also is on the the national directors, our board of directors, sorry, and she is the professional educator and she hails from Ontario. Any thoughts, questions? Chris, you elaborate so beautifully on things. So if they don't have any questions, it must be, I'm going to assume it's because you executed this flawlessly.
Or they're like, I don't know what to ask her.
In short, say yes, surround yourself with people, and don't settle for,
Don't settle.
yeah, just don't settle.
Just don't settle.
And come to CCCN webinars that are coming up and join their mentorship group. And
Yes.
what else? Oh, and the other plug I'm going to throw in right now is that the call for abstracts has not been released yet, but it's coming for our spring conference. It usually comes out sometime in the October-November window. And so if you or your friends, or you together with your friends, would like to put an abstract for spring conference, it's May 29th to 30th, and it's in Saskatoon. Rumor has it it's a beautiful city with an excellent river and a very enthusiastic cardiac department. I'm hoping, actually, Chris, if you could connect.
I think Saskatoon, like Winnipeg, I remember when we were in Ottawa and everyone went, Saskatoon. And I said, remember when you said that when we came to Winnipeg? And it was a really good conference. And there's things in every city. And I think Saskatoon, again, may surprise us with, again, I think they will be very welcoming. And I anticipate we'll have a great, great conference.
I think so. I think these kind of little forgotten corners often have big hearts.
Yes. Yeah. Usually a really good, strong community, right?
Yeah. I would agree.
Absolutely.
Okay. Yeah, there's a few comments in there just saying great. Thanks, chat.
Oh.
Thanks for a good chat.
I'll pay you guys all later, okay?
Wait a minute, is this just your whole unit? Is anyone taking care of any patients right now? This is the whole Winnipeg crew sitting there.
I know. Well, anyone can reach out at any time, of course. Love to hear from people. And if there's ever, people interested in opportunities with CCCN, you've got, a few of us to reach out to. Would love to have a chat.
Yeah. And if you have any thoughts on people or career paths that you think we should explore in these chats, you can always send me or Catherine or literally anybody an email, and eventually it will find me, and I will do my best to find somebody who fits that career journey that you're looking for more information on. Right on. Well, thank you, everybody. Thank you, Chris, and everybody for tuning in, and we'll wrap it up right on schedule.
Thanks, Laura. Thanks, everyone.